So I'm coming today to talk to you about mental health awareness, specifically anxiety and depression. Anxiety and depression disorders are the most common mental illness in the United States, affecting 18% of the population. Depression alone affects 1 in 10 people. Anxiety and depression is treatable, yet because of the stigma attached to it, most people don't seek treatment for this. Mental health costs the U.S. over $42 billion a year. I myself have suffered from depression and anxiety for over 20 years. Nearly half of the people diagnosed with anxiety also suffer from depression. In 2014, around 15.7 million adults experienced at least one major depressive episode in their life. Over 80% of the people with symptoms are not being treated, and that number rises 20% every year. We need to take the stigma off this. Anxiety and depression have become an epidemic. Women tend to suffer from it more than men due to having to work outside the home and adding the stressors of child rearing and household duties. Depression is treatable, yet most people don't seek help for it. It can be something as simple as therapy or medication or the combination of both. 80% of the people affected do not seek treatment. Even the most severe cases can respond to medication and therapy. One of the simple ways that you can get help is by simply reaching out, calling your doctor, telling a friend. Don't be afraid to let somebody know that you need help. Anxiety is another aspect of depression, and most people that have depression also have anxiety. These people tend to refer to themselves as leading a hectic life. Anxiety can manifest in a number of different ways, though. Some signs are muscle tension, poor memory, fear or confusion, constant worry, and my favorite, shortness of breath. I say that sarcastically because that's the warning sign that I'm fixing to have an anxiety attack. You start feeling like you can't catch your breath, you can't breathe, which leads you to panic more, and it just starts this vicious cycle all over again. There are different categories that anxiety falls into. One is called generalized anxiety. The other is panic disorder, and the other one is social anxiety. The most common form is the generalized anxiety disorder. And physicians tend to look at people that have this as a good sign because it can often show that instead of accepting your state of depression, you're actually concerned about it and want to do something about it. The problem is when doctors recommend treatment such as stress relief and time management to help deal with it, people don't follow up with those at home. Therefore, their anxiety continues on, and it's this ever-ending cycle. We need to raise awareness in America so that people can have the freedom to seek treatment and speak up about how they feel and not be ashamed of that. We need to have more doctors and schools talking about this problem, especially with all the bullying and stuff going on in schools these days. Kids need to know that they have somebody to talk to and won't be shamed for it. In conclusion, we've talked about how our country faces an epidemic problem with depression and anxiety today. We talked about how many people go untreated, how simple treatment can be for most people. Not all depression and anxiety has to be treated with medication. Some people could just use therapy. But we need to start by educating America first. Let's let depression and anxiety be an everyday topic. Let's not shame people. If someone comes to you and wants to talk to you about your problems, don't just ignore them or put it off as you're unhappy or sad. Really listen, and don't ignore signs and symptoms of depression in teenagers especially, and people that are contemplating suicide and may voice that. Take those conversations to heart and really believe what they're saying and try to reach out and help these people the best you can. There's plenty of resources on the internet regarding this. All you have to do is put in the word depression or anxiety. Plenty of websites come up There's plenty of associations that you can get help from, or just reaching out to your regular doctor. In conclusion, we just need to make mental health awareness a priority for everyone. Thanks.